DNB equivalent to mdms? Does it take long time to pass DNB? Shall I take DNB or not? So in this video, I want to explain you all the questions regarding DNB. Myself Dr. Shravan, welcome to my YouTube channel Dr. SS. In my previous videos, I have explained you the process of NEET PG counseling and 7 important steps that to be followed throughout the process of counseling. So in this video, I want to explain you the differences between MD and DNB under 7 following headings. First thing, does a DNB is equivalent to mdms? So if we do a DNB in a hospital greater than 500 beds, then definitely DNB is considered as equivalent to mdms. In almost all aspects, we can work as an assistant professor in a medical college and we can consider equivalent to mdms in a corporate hospital. But what happens is, if we do a DNB in less than 500 bedded hospital, then there will be 1 year mandatory SRship to work as an assistant professor in a government college. But other than that, DNBs who are working in who got DNB degree from a hospital less than 500 beds or greater than 500 beds, they are almost equivalent to work in a corporate hospital. The only difference is, less than 500 bedded, they have to do one year of SRship mandatory to work as an assistant professor in a government college. And the latest NMC bill also mentions the DNB and MD equivalence. And in most of the metro cities and peripherals, DNBs has got good recognition and they are performing very well. But sometimes the MDs has more important edge because it is an older degree and it is known to most of the people. Second, coming to the stipend and fees. In almost all the states, the DNBs are getting equivalent to stipend to that of MD and MS. For example, if we take Telangana, the MDMS candidates will be getting almost 50,000 of stipend, whereas DNB is also getting equivalent 48 to 50,000 of stipend. But the only difference is the DNB candidates has to pay a fees of almost 1.48 lakhs per annum for 3 years. But in government college, there is almost negligible fees. But if we compare with the private college, the DNBs will be getting stipend and will have to pay less amount. If we take AP, the ACAT fees is almost more than 4 lakhs and BCAT seat is still more higher. So if you are having any financial issues and you are okay with the DNB degree, you can go for DNB without any further doubts, because DNBs will be getting stipend and will pay less amount. And in the coming years, DNBs is also getting a good recognition. Number 3, seniors and guidance. In most of the DNB hospitals, we will be having only 2 seniors, and in some of the hospitals, even there are no seniors. So we will be lacking the guidance from the seniors, and most of the consultants, they are not interested towards teaching. Only we will get few consultants who are very passionate about teaching and they will teach us. When we compare with that of the MDMS, we will be having 3rd year PGs to guide us, we will be having assistant professors, we will be having associate and unit chief rounds. So we will have different views towards a particular case. So in this aspect, the MDMS will have superiority over that of the DNB. And coming to the personal life also, DNBs will be won't be having any college fest or interns to and co-PGs, most number of co-PGs. But in MDMS, we'll have all these things. So if you are interested more towards a branch and don't want all these, I mean, you are sacrificing all this, then you can go for the DNB degree. But if you are not particular about any branch, you can do any branch, then definitely go for MDMS because you will be having these advantages. So better prefer MDMS if you want all these things. But if you want only branch and you are ready to sacrifice, then you can go for the DNB. Other than that, you can go for MDMS. Number 4. Clinical procedures, skills and experience. So when we compare him at MDMS in a government college, he'll have more free hands when compared to that of the DNB candidate in a corporate hospital. So if you are preferring any surgical branch, better go for a MDMS college if you are getting. And for medical branches, you have a choice between DNB and MDMS. DNBs will have in a medical branch. What happens? DNBs have a little more advantage when compared with that of the MDMS candidates, because the DNBs can do whatever investigations they want to do, and they can give a costlier treatment, and they can see the prognosis of the patient. In this way, they can, if they see a case, they'll understand the disease pattern of the patient and they can do whatever they want to do because money is not an issue. But when compared with the MDMS in a government college, there mostly the diagnosis, most of the times it will be clinical because of the lack of this sophisticated investigations or costlier medications. There we cannot access the prognosis of the patient and will discharge the patient based on our clinical experience only. So in this aspect, the DNBs will have little advantage when compared with that of the MDMS. So, but the experience, MDMS can see the similar case multiple number of times, so it get registered in their minds. But the DNB candidates, they see the similar cases occasionally. So they have to work a little bit hard to note the case, the findings, and whatever the treatment they have given. And they should be updated with all the things that they have done in the hospital regarding that case. So other than that, the DNBs in medical branches, the DNBs almost are equivalent to MDMS in almost all the things. But only thing is they will be lacking a little bit of clinical experience. But they can learn it by doing 1 year of SRC. Number 5, passing and examination pattern. The passing DNB is a little bit difficult when compared with that of the MDMS, because in MDMS the exam center will be our college only and there will be internals to help us. But in DNB what happens is the exam center will be in other state and there will be no one to help us. So we should struggle a lot to pass the DNB. We should prepare thorough enough to pass DNB. And in MDMS, the theory and practical exams occur simultaneously. But in DNB, what happens? If we pass the theory only, then we'll be eligible for the practicals. If we don't pass the theory, then we should wait for other 6 months to pass theory, and then 6 months to enter into the practicals. So this is a little bit disadvantage for the DNB candidates to pass out. But if we see the latest trends of DNB passing percentage, you can see as below. Coming to point number 6, pros and cons. So during the course, the MD will have an advantage of seeing a lot of number of cases. They'll have a good clinical experience and lot of senior guidance, and they'll be having college fest and interaction with the interns. But in DNBs, all this won't be there. But we can see any case and we can investigate it further, and we can see the prognosis of that case. So we'll be having a register of that case in our mind. And coming to the stipend, the stipend is almost equal to the MDMS and DNB, and in most of the times the DNBs will get regular stipends, and MDMS in government college they will little bit delay for every 2 months or 3 months once in most of the colleges. And next, coming to the duties will be very hectic in MDMS, will be not that hectic in DNB when compared to that of the MDMS. So if you want less hectic duties, then you can prefer DNB over MDMS. And coming to the bond, in MDMS, in most of the colleges there will be 1 year of bond or 3 years of bond, in some places almost 5 years of bond. But in DNB there will definitely be no bond. So these are the advantages during the course. And after the course, what happens is the MDMS will have little bit advantage when getting into a job in a corporate hospital when compared to that of the DNB. The DNB has to struggle a little bit when compared with that of the MDMS, because if DNB candidate and MD candidate both apply for a job, then most of the times MD candidate will be preferred over the DNB candidate. But it is not a compulsion. If we perform well and if we have a good experience, the DNBs are almost equal to the MDMS. And when we go to the peripherals, then it is a matter of skill. Who proves themselves very well, then they'll have more advantage. But it doesn't necessarily the MDMS can get a good opportunity or DNB can get a good opportunity. No, it depends upon our clinical skills. So these are the main important pros and cons of MDMS and DNB. 7th one, whether to take DNB or not. All the things that I have mentioned are the current facts. I don't want to hurt anybody, MDMS or DNB candidate. Just I am presenting you the facts. Finally, it is your courage to take any branch and your willingness towards that particular branch. If you are really interested towards that branch, then definitely go for a DNB. Only my point is that for all practical purposes, the DNBs are considered equivalent to the MDMS. Still, there are certain pros in MDMS and cons in MDMS, and pros in DNBs and cons in DNBs. So finally, my word is the DNBs are not inferior to that of the MDMS. Both are almost equivalent. It is important that your branch, if you are interested about a particular branch, go for DNB. If you don't have any interest towards any branch and you are ready to take any branch, then go for MDMS. Myself, Dr. Shravan, signing off. Thanks for watching.